No, it's not the one I want to share. I want to share as my presentation.
And it's gonna live stream on YouTube too, Dr.
This,
Pierre. I tried to get it on Facebook, but it keeps saying that it couldn't get it on there.
okay, is this a video? It
Yeah,
says
it's a
it
video.
is, but how do I make it
It's on.
start? Oh, just press right there on the
Hey
arrow.
everyone, welcome. Good to be here.
Okay, hold
Okay,
on.
so that
Can you
is,
hear me,
I can hear
Dr.
you, but
Pugh?
you're real soft.
Okay. I'm connecting it to a live stream for YouTube too.
Okay. Just press right there on the arrow.
Hey everyone, welcome. Good to be here.
Go all the way back to the beginning. Pause it.
It's on YouTube.
I pause it.
Facebook.
It won't go back.
What's wrong?
Well, that's, I don't know why. It won't let me go all the way back. There we are. I need to do is pull that out. Yes. Minimize this. Have that one window open. There we go. All right. I got the video queued and ready.
Okay, and I have the live feed up for YouTube. I can get I tried to get it on our
I don't
Facebook.
need to pull anything else up, do I? Oh, I can't hear you.
Oh.
Hold on. Because now I'm muted. Okay. I'm not muted anymore.
Can you hear me?
I can hear you now.
Okay, so we are on YouTube right now. So I was able to pull up the YouTube, but I couldn't do the Facebook one. The Facebook one keeps saying, you tried to do this too fast. So it won't let me on. I'm like, okay, fast or slow, it doesn't matter. But I let everybody know that we start at 6. So I've already put that on there.
Let's see. I was trying to, oh, here. I'm trying to see if I can go live on Facebook. Because now I'm logged in as Northeast Ohio Black Health Coalition.
It's just being goofy.
To start. Okay. Switch now.
But let me put it in this way. If it's gonna go back and say.
All right, where do I go live on Facebook? I'm trying to figure that out.
Down at the bottom, it should have the 3 dots. You see where it says live?
No. Oh, wait. I see the 3 dots right here. It doesn't say live.
Yeah, it should say live broadcast, live YouTube, um, under the three dots. I'm doing a LinkedIn live too, but it just will not let me get into Facebook.
Mm-mm. Oh, live.
We have about 4 more minutes.
I clicked on more.
You should see the live.
Oh, it's showing me past live videos.
That part.
But it is not giving me the option to do a live.
That's okay. I'll take it to the ones that we can. So we are on YouTube live. So
Video. Menu.
go back to you. Everybody know what was starting. We'll be starting in a couple minutes, everyone.
Oops.
You okay over there, Dr. Pugh?
I am.
I know I looked at their video. I think it's like 29 minutes long or something like that.
Okay. Mm, log in as myself.
So it'll be just my luck.
What's up? My doorbell.
All right, so I'm going to start. Good evening, everyone. I'm Ivanka Hall. I'm the Executive Director of the nationally recognized Northeast Ohio Black Health Coalition. We are the first coalition in the state of Ohio to focus exclusively on African American disparities. Our work is to create equity by addressing the cumulative impact of racial, economic, environmental, and social justice inequities. So basically, we look at the social and structural determinants of health. Tonight, we are here with the Asthma Minority Community Engagement Project with the Ohio Department of Health to talk about asthma. As you know, asthma is a serious lifelong disease of the lungs that is caused by swelling or inflammation of the airways. It can cause breathing problems known as asthma attacks and can cause wheezing, a cough, or shortness of breath. People with asthma can't live normal, active lives. There is no cure and you can't outgrow it. That's important for you to remember. I have a cousin who thinks that she outgrew asthma, but she did not outgrow it. So what we do know is that some people may stop having asthma symptoms for a while, and it may seem like they have outgrown it, but it isn't gone and it can come back at any time. And so with a program of the Ohio Department of Health asthma program, we work to raise awareness and spread information regarding asthma, the causes, the triggers, and the management, reduce asthma hospitalization rates, reduce asthma disparities for racial and social economic groups, and for us, particularly communities of concern. So I have introduced myself, I have introduced our project. I want Dr. Pugh to introduce herself, and then we'll get started.
Good evening. I am Dr. Lachelle Pugh. I'm the Assistant Executive Director for the Northeast Ohio Black Health Coalition. Welcome to our presentation, and we are hoping that you will all gain some valuable information about asthma this evening. Thank you for being here.
We may have more people that jump in, so we do know that racial disparities in health outcomes for asthma remain in Ohio and nationally very high. Utilizing the insights from the Ohio families about social conditions impacting wellness, healthcare, and the social service delivery models. And so for us, we look at policies and practices because these things are crucial to us understanding what changes we need to make to address the health inequities and to help our families to thrive. Asthma is a leading chronic disease, an illness among children and youth in the United States. And so one of the things that we talk about in these sessions is about Cuyahoga County. And so we know that in Cuyahoga County, the asthma mortality rates in Cuyahoga County for children and Black adults were significantly higher compared to children and Black adults in Ohio during 2016, 2021, which is the period where they looked at the asthma rates. We are here because it was so alarming that they hired us in order for us to do this work. And the alarmingness of this is the number of hospitalizations that we had and the number of deaths that we experienced between children and adults in Cuyahoga County. And so we're here tonight talking about Cuyahoga County. If you know people who have asthma or have children that have asthma or work in settings where you're working with families that may have asthma, make sure that you send them a note and say, that we need them to be on here, because I think that the more that we know, the more that we can help out our community. We know that we have definitely some issues around air quality in our neighborhoods. The large majority of communities of concerns, those communities, our communities, don't have tree canopies. We have legacy lead and other pollutants that are in our communities. And so what happens is where we live, we're living in areas that are very toxic. And so for people who are suffering from asthma, it takes very little to trigger an asthma attack. And so we want them to remember these 6 strategies around exhale. And so exhale is our education on asthma self-management, extinguishing smoking and secondhand smoke. And it's important for us to make sure that we understand how important it is for us to talk about smoking and smoking rates. We live in Cuyahoga County, and I know in Cleveland in particular, About 35% of adults in the city of Cleveland smoke cigarettes. And so because we have such a high smoking prevalence, we will see a larger rate of people who have asthma attacks. The other thing is when we talk about obesity, 1 in 2 adults that currently have asthma are obese versus 1 in 4 adults that currently have asthma that are of normal rate. Depression. So adults currently have asthma are 2 times more likely to be diagnosed with depressive disorder compared to adults who currently do not have asthma. The other thing that we may see is emphysema, COPD. So my aunt recently passed away from complications from COPD and lifelong lifelong bouts with her asthma. She was a chronic smoker, smoked more than 3 packs of cigarettes a day. And because of that, her lungs were deeply impacted. And so when we look at the lifetime of asthma, and what we see is we see about 17.9% of African American adults experience asthma over their lifetime, and about for children, about 15.6 percent of children are experiencing asthma. Make sure that if you have small children or if you're looking at other triggers that we look at, secondhand smoke and thirdhand smoke. So secondhand smoke is the smoke that we're emitting into the air. Thirdhand are the things that are on our clothes, our pillows, other things that we may come in contact with that our family members may also come in contact with. And so it's important for us to make sure that we're looking at that. Over 25% of adults have missed at least 1 day of work due to asthma, and over 20% of children have missed at least 1 day at school due to asthma. About 48% of adults limit their activity due to their asthma diagnosis, and about 33% of children limit their activity due to asthma. So one of the things that we are talking about continually is that it is important for us to talk to our children that have asthma and talk to them about some of the triggers. Particularly since they're away from us for so long, and we have some children who are in summer camp. We actually spoke with a summer camp of students in Lorain County a few weeks ago, the camp counselors, because most of the time when you're in camp or a school setting, you check your inhaler in to the nurse. And so talking with them about the importance of what it is to make sure the students have ready access to those inhalers, particularly if they're out doing many things in nature, if they're in these summer camps. And so for us, looking at the findings and the things that are going on with asthma in the state of Ohio, and particularly for us in Cuyahoga County, are alarming. And so we know that in 2021, approximately 9.68% of adults reported having current asthma. Both racial and gender disparities continue to exist with our populations in Ohio. We know that Black adults experience higher prevalence of asthma compared to their white counterparts. Black adults experience asthma-related emergency department visits at a rate of over 6 times that of their white counterparts. Black adults experience asthma-related inpatient hospitalizations at a rate at almost 6 times that of our white counterparts. And Black adults experience asthma-related deaths at a rate of over 2.5 times that of our white counterparts. Adult women experience asthma emergency department visitations at a rate approximately 1.5 times that of adult men. And you'll see that in the video that we're going to show, where we talk about the rates for women in particular, the death rates of women who are experiencing asthma. Adults over 65 years and older die from asthma at a rate of over 2 times that of adults in alternative groups of other groups, yet the lowest prevalence rate of current asthma between adults and age groups for 65 is the adults age 65 and older die at their rates of higher. And then when we're looking at children, children experience higher rates of prevalence of asthma compared to their white children counterparts. So Black children. Black children experience asthma-related emergency department visits at a rate of 5.7 times that of their white counterparts. Black children experience asthma-related inpatient hospitalization rates almost 6.5 times that of their white counterparts. And Black children experience asthma-related deaths at a rate approximately 14 times that of their white counterparts. So I want you to remember that Black children experience asthma-related deaths at a rate of approximately 14 times that of their white counterparts. And that is why we are here today. The number of emergency room visits in our community with African-American adults and children, and the number of deaths of African-American adults and children raised the alarm on the fact that we needed to make sure that we're out educating our communities about the danger and the lifelong impact of asthma. And so I'm going to have Dr. Pugh start off our video. And then if you have any questions for us, you will be able to ask those. Did you pull up your share screen, Dr. Pugh? There we go. The volume. The volume's not on. It was on a minute ago.
Can you hear the video?
Asthma, allergies, and
I can hear it
oldest
now,
asthma and allergy patient group
you
in
got
the
pull up the
world.
video.
Our mission is dedicated, AFA is dedicated to saving lives and reducing the burden of disease for people with
Okay.
asthma and allergies through
Now start it all
advocacy,
over.
education, research, and support.
I'm trying to right here.
Okay, there you are. Okay.
All right.
No, you just gotta
As
start.
Asthma and Respiratory Health Program Manager, and we are going to talk with you a little bit today about asthma self-management. Okay, here's our quick agenda. We're going to talk briefly about some facts, some things about health disparities, some asthma basics, some tips on how to manage asthma and avoid triggers, some resources, and where to submit questions. So if you're not familiar with AFA, we are a national patient advocacy organization, was founded in 1953. We're the leading patient organization for people with asthma, allergies, and the oldest asthma and allergy patient group in the world. Our mission is dedicated, AFA is dedicated to saving lives and reducing the burden of disease for people with asthma and allergies through advocacy, education, research, and support. So I'm going to talk with you a little bit about some asthma facts. So asthma is one of the most common and costly diseases in the United States. Over 27 million people in the US have asthma. This is about equals to 1 in 12 people. It's a leading chronic disease in children. About 4.5 million children under the age of 18 live with asthma. It's more common in male than female children. And non-Hispanic Black children are nearly 2 times more likely to have asthma compared to non-Hispanic white children. Adults, some asthma facts for adults. So 22 million US adults aged 18 and older have asthma. And asthma is more common in the adult population in females. So it's flip than males, 10.8% of versus 6.5. And asthma rates are highest in American Indian or Alaskan Native adults in the US. This is a slide discussing the burden of asthma on the Black, Hispanic, and Indigenous individuals in the US. Unfortunately, the burden of asthma falls heavily on these communities, and they're at the highest risk of asthma rates, hospital visits, and deaths. Black people in the US are nearly 6 times more likely than white people to visit the emergency department due to asthma. So AFA knows that this can help us shape how we approach health education in all communities. And we work on policy changes to ensure equitable access to things like healthcare and other resources. Talking about health disparities, we know that health disparities result from a series of factors, many of which stem from environmental or social injustices. So racial and ethnic disparities, they're complex and they vary across levels of social structure and genetic factors. Things like unequal distribution of stressors in people's environment. So things like living in poverty, not having access to good housing, not having access to things like quality health care, things like that can be part of those systemic injustices that I mentioned and racism that has been deeply ingrained in the US policies and culture. Um, Things like we referred to some in the healthcare space, you might hear the term social determinants, and those are listed on your slide there. And it's speaking about situations that people are born in that determine health status, things like education, whether people have access to healthy neighborhood and social support. Looking at the environmental conditions that contribute to health disparities, hazardous environmental exposures are a growing concern, especially in light of climate change. So exposure to hazards can have a significant impact on health conditions like asthma. The risk of exposure to environmental health hazards depends on where you live. So some communities, such as low income or communities of color, are more likely to reside in neighborhoods that were founded on racial segregation and other environmental justice. So many economically disadvantaged communities are in close proximity to industrial and hazardous waste sites, for example. And these sites are known to release toxins and contaminants that disproportionately burden those surrounding neighborhoods living in that community. So that increases people's exposure to environmental health hazards, which enhances the risk of poor health outcomes. So talking about health equity, that was a lot of discussion about the concept of health disparity. So flipping it, health equity is really what AFA is committed as a core value to improving, and it's a mission critical priority of the organization. So health equity is a state in which everyone has a fair and just opportunity to reach their highest level of health. And we as an organization know that it requires strong, coordinated efforts in communities nationally, locally, working on policies, systems improvement, and reducing and eliminating personal biases that are causing harm to many communities. So we're going to talk a little bit about asthma basics. I'm going to hand this over to my colleague Jessica, who will share some general information about asthma.
Great. Thanks so much, Lynn. Yeah, so first I'd like to just share some information about what asthma is. So essentially, asthma is a chronic lung disease that causes inflammation and also narrowing of the airways. And this inflammation and narrowing can lead to asthma symptoms, which can be any combination of coughing, wheezing, shortness of breath, and or chest tightness or pain. So unfortunately, there's no cure for asthma, but it can be controlled with the right combination of medications and trigger control strategies. And when these medications are taken properly as prescribed, and also when triggers are controlled, most people with asthma can actually live a healthy and active life. So a lot of factors have been linked to an increased risk of developing asthma, but it's very difficult to find a single direct cause. However, it does appear that asthma is more likely if someone in your family also has asthma, especially if that person's a close relative, like a parent or a sibling. Asthma is also more likely in people who have other allergic conditions like eczema or rhinitis, which is just another name for hay fever. Additionally, urbanization, it's associated with an increased asthma prevalence, and this is likely due to multiple lifestyle factors. And events in early life can also affect the risk of asthma. So essentially, it impacts the developing lungs, and this can increase asthma. And these factors include low birth weight, prematurity, exposure to tobacco smoke, and other sources of air pollution. And it also includes viral respiratory infections. So exposure to a wide range of environmental triggers such as allergens and irritants are also thought to increase the risk of asthma. And this includes indoor and outdoor air pollution, things like house dust, molds, occupational exposure to chemicals, fumes, dust, and other triggers. And then finally, children and adults who are overweight or obese, they're also at greater risk of developing asthma. So with asthma, there are three main changes that take place in the airway. So first, asthma causes inflammation, and it also causes an overproduction of mucus inside the airways. And this in turn, it causes the airways to become overly sensitive or hypersensitive. And this hypersensitivity makes the muscles that are wrapped around the airways spasm. And this is known as bronchospasm. So the inflammation, the overproduction of mucus, and the bronchospasm causes the airways to become very narrow, and this narrowing leads to asthma symptoms. So fortunately, even though there's no cure for asthma, it can be managed with three steps. First, avoid asthma triggers, so the things that make your asthma worse. Second, take medications to prevent and control your asthma symptoms. And then third, you want to treat your asthma episodes if they occur. And we'll discuss this more throughout the presentation. So people with asthma, they have airways that are sensitive to certain things that might not bother people who don't have asthma. And these things are called triggers, and they vary from person to person. So when a person with asthma is exposed to something they're sensitive to, this causes an inflammatory response inside the lungs. And this inflammatory response, again, leads to asthma symptoms. And so examples of common triggers include allergens, and this can be things like pollen or dust or mold, animal dander. Irritants can also trigger asthma, and examples of irritants include smoke, chemicals, perfumes. Another very common trigger is respiratory illnesses, things like colds, the flu, and additionally, strong emotions, exercising, weather changes, or extreme weather, and GERD, which is another name for acid reflux, can also cause asthma symptoms. And other less common triggers include foods, especially those that contain things like sulfites. So an example could be like wine or sometimes foods like shrimp or dried fruit. Some people are also sensitive to certain types of medications, like NSAIDs. And an example of an NSAID would be something like ibuprofen. And then others can be sensitive to certain types of heart medications, like beta blockers. So in general, it's really important for people with asthma to avoid their triggers, and you can do this by adopting multi-component strategies. The one exception to this, though, is exercise, in the sense that it shouldn't necessarily be avoided. So usually providers will have people with exercise-induced asthma, or it's also called exercise-induced bronchoconstriction, pre-treat with a medicine, usually about 10 to 30 minutes prior to exercising or being physically active. So there are many medications that can treat asthma, and they're divided into three main categories. So first, there are controller medications, which your provider may have you take daily, even if you aren't necessarily having symptoms. And controllers, they address the underlying issue of asthma in the sense that they reduce the inflammation and the overproduction of mucus inside the airways. And controllers typically work very slowly over a long period of time. And in quick relief medications, these are used as needed. They don't address the underlying issue of asthma in the sense that they don't really they do a whole lot for the inflammation and the overproduction of mucus inside the airways. They do, however, temporarily relax the muscles that are wrapped around the airways. And when those muscles relax, this pulls the airways open, which creates a much bigger space to breathe inside the airways. And so quick relief medications, they work very fast, but they don't last long. So typically their effects last about 1 to 4 hours, depending upon the person. And then finally, there are combination medications that aim to both control and relieve. And this is called smart therapy. And we'll discuss that more on the next slide. So essentially, smart therapy, it combines controller and reliever medications into one inhaler. And again, it can be used to both prevent asthma symptoms or relieve them. And two examples of these types of medications are Symbicort and Delura. So these are both inhalers, and they have a combination again of controller and reliever. So despite the fact that asthma can't be cured, it can be controlled with the right asthma management plan. So it's really important to work with your healthcare provider to create an effective asthma management plan, as most of these plans will help you recognize your symptoms and your triggers, and also provide information on how to treat your symptoms and avoid your triggers. An important first step in asthma management is to recognize when you might have asthma or are having an asthma episode. And this can be done by identifying your signs and symptoms. So again, common asthma signs and symptoms include shortness of breath, coughing, wheezing, waking up at night due to asthma symptoms, and or a drop in your peak flow meter reading if you use one. And so for those of you who don't use a peak flow meter or who aren't aware of what a peak flow meter is, it's a handheld device that measures how well air moves in and out of your lungs. And during an asthma episode, your airways, because they become narrow, it can be very hard to move air in and out of your lungs. So if you blow into a peak flow meter and you get a low reading, this could be indicative of the fact that you are having an asthma episode, even if you're not necessarily feeling symptoms. And the peak flow meter can measure the narrowing in your airways hours, sometimes even days before you actually have asthma symptoms. Asthma can be a serious disease, and it is important to see your healthcare provider for initial diagnosis and treatment, and also for ongoing asthma management. So untreated and uncontrolled asthma, it increases the risk of asthma-related hospitalizations and deaths, but it also can cause scarring inside the lungs or inside the airways. And this scarring, it permanently damages lung function, which can lead to the development of other respiratory diseases like a chronic obstructive pulmonary disease or COPD. So it's really important to create an asthma action plan in partnership with your healthcare provider. And this should be a written plan that has patient identification, information such as date of birth, and specific instructions on what asthma medications to take and when. And it's all based on asthma symptoms. And again, possibly peak flow readings if you do use a peak flow meter. And if you don't have an asthma action plan already, you can print one off on APA's Asthma Action Plan website at apa.org/action plan. So if you have asthma, it is important to keep track of your triggers. And because symptoms don't always occur right after exposure to your triggers, it might take a little bit of detective work to identify exactly what makes your asthma worse. And delayed asthma episodes, so they might occur depending upon the type of trigger and essentially how sensitive a person is to that particular trigger. But once you know your triggers, it is important to adopt multi-component strategies to reduce exposure or to manage them. And we'll discuss examples of these strategies on the following slides. So first, we'll talk a little bit about outdoor trigger avoidance strategies. So first, air pollution, we'll talk about that. Essentially, air pollution or small particles and gases in the air, they can pass through your nose or your mouth and get into your lungs and into your blood. And both long-term and short-term exposure to air pollution can cause many health problems. For example, it can increase asthma attacks, it can worsen your asthma, it can also damage your heart and your blood vessels and cause cardiac diseases. Additionally, long-term exposure can lead to adverse birth outcomes like preterm birth, low birth weight, stillbirth, and it can also lead to early death. So pollen is one of the most common triggers of seasonal allergies. And as noted earlier, allergies are a big trigger for asthma in a lot of people. And there are actions you can take to reduce allergic reactions to pollen. So first, try to limit your outdoor activities when pollen counts are high. And this will cut down on the amount of pollen allergen that you inhale, and it also can help reduce your symptoms. Another strategy is to keep keep windows closed during pollen season or peak pollen times. And also, if you have it, try to use central air conditioning or air cleaners with a certified asthma and allergy-friendly filter and/or a HEPA filtration device to reduce indoor airborne allergens. Additionally, you can wear sunglasses and also cover your hair when going outside. And this keeps pollen out of your eyes and also off of your hair. And then you want to be sure to shower daily before going to bed. So this removes the pollen from your body and it also keeps it off of your bedding. And additionally, you want to limit close contact with pets that spend a lot of time outdoors. So one strategy is just to wipe furry animals off when they come inside, or if you can, bathe them weekly. Additionally, changing and washing your clothes that you wear during outdoor activities is really important. This also washes the pollen off. And then when you dry your clothes, be sure to put them in a clothes dryer or hang them up inside. Don't dry them on an outdoor line because this will just collect more pollen. And then finally, you just want to keep an eye on pollen counts and forecasts. So mold is a type of fungus that produces spores that float through the air, and it can grow on almost anything when moisture or damp environments are present, and it can be found both indoors and outdoors. So mold it's also a common cause of allergy and asthma symptoms. And mold seeds, which are also called spores, they essentially travel through the air. And when you upset a mold source, this can send the spores into the air, and this makes it easier for you to breathe them into your lungs, which can then trigger allergy and asthma episodes. But you can reduce your asthma and allergy symptoms by avoiding contact with mold spores. And some steps that can help include limiting your outdoor activities when mold counts are high. Also, remove leaves and piles of dead plant material or tree clippings as soon as possible. This is because mold tends to grow in dead plant material and tree clippings. Additionally, you might want to wear an N95 mask, hat, and sunglasses when you're caring for your lawn or garden. And if you can, try to have somebody without a mold allergy do your yard work if possible. And then finally, promoting groundwater drainage away from your house is important as well. Exposure to air particles in the smoke that's released during a fire can also irritate your lungs, and this can worsen your asthma symptoms. But again, there are steps you can take to help keep yourself safe. First, you want to track the air quality index in your area, and you can get current readings on airnow.gov. You can get it on weather sites and also on smartphone apps and from local news reports as well. Additionally, you want to try to keep your asthma under control as much as possible. So you may need to ask your allergist how you can prevent symptoms, and they might have you increase your medicines and decrease your outdoor physical activities while the air quality index is high. And then finally, working and exercising inside while the air quality index is high is important as well, if possible. That's because physical activity like exercise, it causes you to breathe faster and deeper, and this can pull more polluted air deeply into your lungs. But if you have to spend time outside, then it is best to wear the N95 rated mask. And this is because cloth masks and face coverings, they don't provide enough protection from wildfire air pollution. And when you are wearing the N95 mask, be sure to cover both your mouth and your nose and also protect your eyes. And then finally, you also want to improve your indoor air quality. So since you'll be spending more time indoors, it's equally as important to make sure that your indoor air quality is good. Um, the polluted air, it can actually enter your home and get trapped there. And we'll discuss steps for improving indoor air quality in just a bit. So essentially, you want to be mindful of air quality and avoid spending a lot of time outdoors when air quality is poor, if possible. And you can visit the National Allergy Bureau at quadai or AAAI.org/NAB for pollen count information. Again, you can also visit airnow.gov for Environmental Protection Agency air quality alerts. And both of these websites, they also have apps that are available for smartphones and tablets. And additionally, local news reports often share pollen count and air quality information as well. And now I will move on to indoor trigger avoidance strategies.
We're going to talk a little bit about environmental triggers, things like dust, pets, and mold that Jessica talked about that can cause asthma and allergy attacks. And then they can be possibly life-threatening. we want to minimize exposure to those triggers and create a healthy environment if you have asthma and allergy. And so having good indoor air quality is a key component of this and essential for creating a healthy living space. So most people in the US spend about 90% of our time indoors, and our indoor air, believe it or not, can be 2 to 5 times more polluted than being outside. So we offer a free asthma-friendly home checklist.
Michelle, it stopped.
Indoor air quality
stop
with
it?
you
There you
today. Okay, so how to improve your indoor air quality and reduce triggers in the home. Um, Cutting down sources of allergens and asthma irritants throughout your home is possible. Things like improving airflow in your home, so leaving interior doors open while running exhaust fans in bathrooms and kitchens can be a good strategy. Avoid harmful plants can be a good strategy.
You were okay. You were okay. You can put the volume back.
Okay. We'll go back to.
On bedding, using HEPA vacuums, cleaning products, things like that. Have a regular cleaning routine to remove dust, pollen, dander, and mold. Measure your home's humidity level. If you have moisture, try to keep it below 50%. You may need what's called a dehumidifier to reduce that moisture. Keep windows closed during peak pollen times, like Jessica mentioned, and also times of high outdoor pollution. Things like scents. So we love a good scented candle, but unfortunately, we know that things like scented candles or cleaning products can actually trigger asthma. So removing those from your home is recommended, and using things like battery powered ones. Carpets are a huge trigger potentially, so replace those if you can with solid surface flooring. Maintain your HVAC or furnace and air conditioning system, replace those air filters, use a portable air cleaner, air purifier in rooms where you spend the most time. Okay, so depending on where you live, obviously you all are in Ohio, there's going to be Ohio specific housing codes. And so it's ideal to not for families not to be exposed to harmful asthma triggers. So by law, landlords are required to abide by state housing codes that protect people's health and people's safety living there. So this is just a quick snippet. You can check out your Ohio code at codes.ohio.gov if you're interested. And then local organizations like Ohio Healthy Homes Network may be a good resource to help. If you are a renter and you know that there are things in your home that are making you sick related to your asthma, here's some just general tips for talking with your landlord. We know that this can be overwhelming process for some, and people are worried about retaliation or losing the housing. So reaching out to a local resource if you feel like that's needed to help with advocacy, that should be available. But one general tip is to first talk about the issue informally with your landlord. A conversation via email, via phone, however that works for you. Um, then you can start. This also kind of helps document your timeline, ideally putting that timeline in writing so you have it. If that doesn't work, you can formally communicate in writing and outline your request as well. If they ignore your request, then you can notify your landlord that you may take further action if it's not resolved, and that you may have to, show proof that you tried to resolve it out of court. So definitely seek your local resources. I'm going to talk a little bit very briefly about AFA's resources. So that was a lot of information. Thanks for sticking with us. we are a national organization, but we do offer resources for anyone across the US. We have lots of resources on our free AFA store. We have a support center, which is a toll-free hotline available Monday through Friday, 10 a.m. to 3 p.m. Eastern Standard, except US holidays. We request 2 business days for a response. You can also email us, but if you have a question or need some guidance on how to um, live with your asthma, we can help with that. We have a couple online communities, which are online support groups that you can join. One is specific to asthma and one is specific to food allergies. We also have a learning catalog for families and patients, healthcare providers. We have some CEU opportunities if you have a credential that you need those opportunities. We have Ask the Allergist, which has some common questions about asthma and allergies that our board certified allergists can answer some general information. But this is definitely not substitute for medical advice from your physician. And then we talked a little bit about our asthma and allergy friendly certification program. You can learn more about that and those products at that website. Lastly, wanted to let you all know, AFA has partnered with some program advisors and created the Black Women's Asthma Alliance. And part of that resource is a Facebook group that is specific to this community. It's for caregivers who may be taking care of others with asthma or people that live with asthma themselves. It's a private group. We'd love to have you join us. Just scan that code with your phone camera, or you can get directly to the group by typing in afa.org/join BWAA to get to that group. So love to see you there. Really quickly going to talk to you about some safe cleaning products. The EPA has a nice list of things that you can buy over the counter. Their Safer Choice program, it is a label that can help consumers identify what might be healthier and for your lungs to have in your home. And then feel free to take a quick picture of this. Here's some great safer cleaning recipes with just a few basic ingredients. You can create household cleaners that we recommend, and believe it or not, are very effective and very economical too. We are obviously not with you all in person, but you can reach us if you have any questions at programs@aafa.org. And I'm going to end the slideshow here. Okay, so it was great to meet everyone. Thanks for your time, and we look forward to seeing you on our online communities or any other dates. And again, thanks to the hosts for having us, and we hope you found this beneficial.
So we've added some things in the chat for you. There are a couple of things for you to remember. I think Dr. Pugh is going to add something else, but for me, it is, we want to thank you for attending. We want to have your name, your email address, and zip code. If you don't feel comfortable adding it into the chat, you can send it to us at info@nelbhc.org. If you or a loved one has asthma and you want to participate in a focus group, the focus group, you'll be compensated for your time. It's an hour-long focus group. What we will do is pass your name onto the group Groundworks that is conducting that focus group. So make sure that if you're sending us an email or if it's in the chat, that we have your name, your email address, and your zip code. So we'll know exactly which people are coming from, what counties we're concentrating in. Our work is concentrated in Cuyahoga County, Mahoning County, and in Lorain County. So there were a couple of things that she said that was said by Alpha. today, and one of them was about the indoor air quality. And so making sure that you are keeping down dust, looking at your pets. I know that I have met someone who vacuums their pet a lot in order for them to keep the hair down. Looking at mold and things that areas where you may have that have quite a bit of mold. And Brianna, I will get to give me 1 second. I'll get to your question. I have not forgotten you. The other is rodents. If you have rodents and you're doing some things to get rid of either bed bugs or roaches, and a lot of times what happens is we set off these bombs in our homes, and it may cause us or our children to have an asthma attack. But when they have the attack, we don't associate it with the fact that we set the bomb off in the house or that we try to use some other things in order to get rid of the bugs. And so when we go into the emergency room department, we don't tell them that we've used that. And so making sure that if you have a child and you are using things to get rid of bugs, that you do not have the child that is there in the house, or that you have an opportunity to go to another house while you're airing out your house. Make sure that the windows are open. The other thing we do is we close all the windows down, making sure the windows are open. The other thing is that during this time of year, we like to barbecue. And so if you're outside and you're barbecuing, because we're not on these massive estates, you are close by your windows or close by your neighbor's windows when you are starting fires. And so as you're using charcoal, understand that it may also be a trigger for you. Currently, our COVID rates have been excessively high in this area for quite some time. So we have a high percentage of people who are being diagnosed with FLIRT, which is the new variant of COVID. And so be very careful about gathering in large groups, particularly if you're prone to have asthma attacks or particularly if you're not vaccinated, because having asthma and having COVID can be very hard on your lungs. The other is around vaping devices. We talked about smoking earlier, and they talked about smoking in the video, but we didn't talk about this whole thing around vaping. Making sure that you are not in close proximity to people that are vaping, or that you're not vaping around your kids or in your car. Vaping sends out some of the same carcinogens as smoking. And so it's important for us to know that. I was actually walking through Macy's the other day, and a lady was vaping inside of Macy's. At first I couldn't believe it, but now I kind of believe everything. But yeah, she was vaping in a department store. We talked about candles, perfumes. A lot of times when we put on perfumes, we put it on not only for us to smell it, but we want everybody else to smell it. And so if we're going to visit people who are elderly or have other types of illnesses, or they may have asthma or some other things, be careful about the things that you're spraying on yourself. Keeping dust down in your homes, particularly now as we've opened up the windows and dust is kind of floating around. We talked about cleaning products. We talked about humidity and humidifiers. And the other, if someone is cutting grass in your yard and you are having some asthma issues, you may want to close the windows and not go outside while the grass is being freshly cut. That would be important to you. And also the idling of cars and motorcycles. So if you're near places where people are idling their cars because now it's warm, and so people are sitting in their cars with the air on, or they have their motorcycles running, be very careful if you have asthma. And Ms. Jones, I'm going to allow you to talk. How are you? You have a question for us?
Brianna, you're muted.
Oh, okay. I was wondering. I'm like, I'm talking. Um, so the chat is not allowing me and a couple other people to respond in it, but I figured out how to email. I just email my information. I don't know how to like not raise my hand.
Okay.
But yeah, it's not working though for some of us. We can't
Okay.
write it at all. It says
I'm gonna put
disabled.
it- oh.
You know,
Okay.
you could just add it to the Q&A.
If you add it to the Q&A, we should be able to get it.
Okay. I sent it via email though. Thank you though.
Okay. Thank you.
Are there any other questions or concerns? Dr. Pugh, do you have a question for our attendees?
Um, well, yeah, the question that I have, I would like to know if the attendees found the information interesting. Did anyone learn something that they didn't already know today? I saw Nicole's hand.
Okay, let me unmute her. Nicole, make sure you unmute yourself.
Yeah, I was just wondering why does everything always attack Black people?
Well, a lot of the reasons why for asthma is because of where we live. Usually we live closer to highways. We don't have a tree canopy. And you know, when you're in neighborhoods that have trees, the trees
Mhm.
actually do a lot of the filtering of the toxins out. And so it actually protects you. So a lot of times when you come into our neighborhoods, you
Mhm.
don't see trees. Let me, you know, one of the things I talked to an environmental group a few weeks ago, and I travel a lot. And so one particular time, I look down all the time now. But when I look down from the air, I can tell you exactly where communities of concern are. Because when I look
Oh
down from the
wow.
air, I don't see trees. So I can look down from the air and tell you exactly what types of conditions are going on in the communities where I don't see trees. And so a lot of times what happens is we think, well, because my mother had asthma, I had asthma, and my grandmother had asthma. Well,
Mhm.
it's not genetic. It is directly related to where you live. And
Okay,
so,
I always thought it was genetic too, so that's something different.
yeah,
New I
so
learned.
yeah, so it's direct related to where you live. And so most of the time we live in the same places where our grandparents have lived and our great grandparents. And so because we are living in the same neighborhoods, the same things are going on there. And we have a lot of legacy pollutions that are in our neighborhoods.
That makes sense. What about the part when they said the males have it the most? Why is it attacking males more than anybody
Females
else?
have
Oh, that's what she was. I thought it said the males.
female hospitalizations have been higher. And I think it's just because of lung capacity smaller.
Mm.
Um, smaller frame, you know, capacity for women. But women have, the rates are higher. And I talked about that when I talked about the hospitalizations
Mhm.
for females were a lot higher than that for men,
Okay,
particularly.
I heard you wrong. I had wrote it down what you were saying. I put the males had. Okay.
Yeah. So
Hmm.
our female hospitalization rates are very high. And you did you write down the children that the children 14 times more
14 times.
likely to
Yeah,
die?
more. Yeah.
And then if you are like with a group and you need the folder, if you send us your information either in the Q&A, we
Mhm.
have a folder of like lots of information that we can send out to you. And so what we will
Okay, when I try to write in here, it says disabled for me to click on anything on
oh,
the
you can
Q
put
and
it
A
in Q&A.
questions.
If you put it into the Q&A, we can get it. And so Dr. Q will pull it out of the Q&A.
Oh, I gotta click ask questions. Okay, never mind, guys.
That's
Oh,
okay. Any other questions?
no, that's it. Thanks.
Nicole, your hand is still up. Is that a legacy hand or is that a new one?
Oh, okay. How do I? Lord have mercy. I'm taking it down.
Oh, that's okay. And Mr. Bradford. Hold on, let me allow you to talk. Sorry. Yes. Mr. Bradford, you can unmute yourself and you can ask your question.
You can hear me now?
I can hear you now.
Okay. Is it true that certain foods really be having flare-ups on your on asthma?
Well,
Like,
when they talked about some of the things that are in foods, in particular, spicy foods that are really cold, having these extreme drops in your body temperature may cause you to have a flare.
all right, and you also said mold as well.
And mold. And when you have old houses, and remember that a lot of us live in neighborhoods where we have old houses. And so usually what we see is decaying roofs, and then we'll see mold down in the basement area. Or if they have like moisture issues, we'll see it in the corners. And so it's ways that you can actually go in there or have someone go in to help clean the mold out of your homes. And so, you know, thinking about that. And if you have asthma, it shouldn't be you. So making sure that it's someone else who is professionally qualified to be able to do mold remediation.
Okay.
And then they had the formula on how to make like your own dishwashing liquid and other things. And so we know that there's something in that, in the fact of using vinegar to clean, because remember before we had Windex and all of these other things,
We use
that's what your
vinegar.
grandmother used. That's what your mother used.
Wow.
Like, because I can distinctly remember going to my great grandmother's house and smelling vinegar
Mm-hmm.
after
Me
she
too.
cleaned the windows.
Okay.
So, and cleaning the glass on the furniture, with vinegar. And so looking at those things and not using a lot of the other things, because what happens is when you start mixing stuff, you may cause some triggers. I remember years ago, I was doing something, trying to do something quick, and I poured bleach in something and forgot I poured the bleach in it and poured some comment on it. And it set off this whole smoke thing in my house and forced
Wow.
outside. And
Okay.
and I'm thinking, wow, if I had had my face down in here, I probably would have been on the floor. And so thinking about how we're mixing things up, because a lot of times we mix things up because we think that more is better. And so we take pine sol and other things and we stick it all in a bucket and we're like, okay, I'm gonna clean with this, and not even think about, you know, the impact that it may have on children who are playing, or even on yourself.
Okay.
Other questions? Mr. Bradford, do you have any other questions?
Oh, no, ma'am. I do apologize.
Oh, that's okay. Do we have any other questions from any of our other guests?
And
Well,
I got contact information from 4 people. I have that, and so we'll be able to um, share information with you as appropriate.
yeah, and if they want if they want the book of asthma information, to make sure that they also share their
Yes.
information and address so that we can send it to them. So you can send your address to the info HC, and we'll be sure to send it over to you. So we thank everyone, considering, I hope that we have answered everyone's questions. If you have any other questions and concerns, you can email them to us. You can email them to the Ohio Department of Health, their asthma project. And I hope that you have found this very informative, this session. We always wish that we could get hundreds and hundreds of people to come, considering the fact that our communities are disproportionately impacted. But we are so glad that you decided to spend an hour of your time with us. Thank you so much, and you have a great evening. Hold it. We have a hand. Did we have a hand? Did we have a hand that goes?
Yes. I was wondering though, like, cause it's not letting me send my information at
Put
all.
it in the Q&A. Did you see the Q&A box on the bottom?
Yes, I went to the Q&A and still not letting me really send no message.
Can you send it to info@neobhc.org?
I could try. I have my friend help me out.
It's our email. So if you can send it to our email, or if you,
Yeah,
can you,
I will make sure I do that.
can you give me your phone number and I can just call you back?
Right now I don't have a phone number at the moment. I'm only through email.
Okay, so if you can email it to me, I'll put the email down there again, and we'll make sure that you get whatever else you need.
Okay, thanks.
Thank you.
I
Thank you.
got information from Ms. Steverson, Mr. White, Ms. Stewart, both Ms. Stewarts, and from Ms. Jones. Okay. So if
Thank you all so
anyone,
much. You have a great evening.
oh, Kelly McIntyre raised a hand.
Oh, Kelly, let me unmute you. Kelly. Yes. Miss
Yes.
McIntyre?
Yes, I just wanted to say thank you all, ladies. The session was very informative for me and my family.
Oh, you're welcome so much. Thank you for coming.
Thank you.
All right. Have a good one, everyone.
You
Okay.
too.
Right, you too.
Bye-bye.
Bye-bye.
I'm gonna take give me 1 second, Dr. Pugh.
Okay.
Take the
So we had
Hold on, let me
1,
stop.
2, 3,
Let me
4,
stop
5,
recording.
6, 7. There were 8 people. Brianna Jones at one point was in there twice. So it was 8 people. I had 8 different names that attended. And then
We had Kayla was in there.
yeah, I got Kathy Steverson, Kelly McIntyre, Lamar Bradford, Natasha Stewart, Nicole Stewart, Quentin White,
Thank you for attending.
and Kayla Boston.
Thank you for attending. We appreciate it.
And then Brianna Jones was in there 2 times. At some point, she was in there 2 times.
Okay, so how many people do we have? Because on
1,
here I
2,
had
3,
that we had
4,
10
5,
attendees.
6, 7, 8. So 8. With the 2 of us, it was 10.
Okay.
Because I kept looking at the number. I'm like, where's that? But then I realized it was using us.
But I'm glad we got 8.
Me too. I thought, well, and we had 8 people that really enjoyed it. They got something out of it. They learned something that was good. And